Okay. Well, welcome everybody. Thank you for joining our Educating Empowering You program. I am Sarah Clute-Bain. I'm the Boone County Hospital Foundation Director. We sponsor this monthly program, and just a couple of quick notes before we get started with our program today. We are not going to have a program in May, but we will in June. So we're actually going to be doing a program in June on cybersecurity, which I think will be really helpful for the general public. I know we get a lot of training within our work, but maybe not something the general public is well aware of. So be on the lookout for the information about that. And I'm just really pleased today to have Heidi Kennedy here with our Senior Life Solutions program that we just got started at Boone County Hospital. I did a little bit of research, so I have questions and excited to hear more about it. But it definitely looks like it's a program that's popping up in a partnership format within many hospitals around the state of Iowa. So just looking forward to hearing more about this program and how it benefits our seniors in our communities. So I will turn it over to you, Heidi, to get us going.
Great, thank you very much, and thank you for having me. We are so excited to be a part of the Boone County Hospital and to be able to focus on our community. Um, so I am going to share my screen here. Okay, wonderful. So we are going to talk a little bit and go over our intensive outpatient program. This is an overview of Senior Life Solutions. My name is Heidi Kennedy, and I am the program director of the Boone County Hospital Senior Life Solutions. And today I'm going to give you an overview of who we are, what we do, and how you can be a part of it. I will review our program with you first. So just to respect everybody's time, after the presentation, we will have a question and answer part, and I will offer my email in the chat as well. That way, after, if you have any questions, you will be able to get a hold of me and have that further communication. So who are we? We are the Boone County Hospital Senior Life Solutions. We are located on the second floor at the hospital on the west end. So let's talk a little bit about our team and who we are. So we have a medical director. She is a psychiatrist located in Florida. Her name is Nina Jardania. She provides all of her services via telehealth. Next is our program director, which is myself. I'm Heidi Kennedy. I am a registered nurse, and I have been a registered nurse for approximately 12 years. However, I have worked in the healthcare industry for approximately 24 years. Next, we have our licensed therapist, Amy Dombrowski. She is a licensed medical social worker. Amy has been a licensed medical social worker for 18 years. However, she has been a social worker a total of 21 years. And we just recently welcomed Jordan Rexrot into our, sorry, Jordan, I know I just said that wrong again. Um, we just welcomed her into our program. I'm very excited to work with her. I've worked with Jordan in the past. She has worked in healthcare for approximately 12 years, and she has lots of experience working with the elderly population in assisted living, which is where her and I worked together in the past. Our team works to provide exceptional patient care and offers mental health support and education to our local community. So who are we? We are the hospital's intensive outpatient group therapy program. We are the Boone County Hospital's intensive outpatient group therapy program. So in other words, your local senior life solutions program for older adults. Our program is designed specifically for older adults experiencing behavioral or emotional difficulties. We focus on helping older adults in the community navigate difficult life transitions and regain a quality of life. Some examples of the life transitions you may see will be becoming a caretaker for your spouse or a loved one that maybe has dementia or another chronic illness or illness that they are working through. You may have a chronic illness yourself and maybe working through those issues that come along with that. Maybe the loss of a loved one, whether that be a spouse, a family member, high school friends, community friends, church members, or you've had a recent health diagnosis. You may also experience transitions such as moving into a retirement community or a nursing facility. And there may be some that are losing their independence from driving or being able to be as active as they once were. We are a department within the Boone County Hospital, and we are affiliated with the Boone County Hospital, and so we work closely with the hospital to get the word out for our program. We are the hospital's intensive outpatient group therapy program. As Boone County's intensive outpatient program, we are the intermediate step of continuation of care between inpatient and traditional outpatient mental health care. Why are we here? Well, we are here in your community, and here's a little bit about what we do. We meet the unique needs of older adults struggling with depression and anxiety, often related to aging. As I said before, we are here to help our hospital and the community meet the unique needs of older adults struggling with depression, anxiety, grief, or loss. To meet the unique needs of older adults struggling with depression and anxiety, often related to aging, our team is highly trained with over 50 years of experience to provide exceptional care and to provide mental health support, education to our hospital and local community. We hold ourselves to the highest accountability related to clinical compliance and patient-centered care. What are the consequences of untreated depression in an older person? Well, first are an increased risk to for having medical illnesses. So some of the medical risks for untreated depression would be cognitive decline, confusion, decreased attention or concentration, heart disease, poor nutrition, and risk of infection. So stress supporting the immune system. There is also an increased risk for suicide. So according to the Suicide Prevention Resource Center, suicide rates 20% of the population and 40% of suicide victims are over the age of 60. After the age of 75, that rate is 3 times higher than average, and among white men over 80 is at 6 times higher than average. So what does depression look like for older adults? That can be a lot of different signs and symptoms. And so some of the things that we're going to look at and maybe recognize would be a change in appetite or weight, change in sleeping patterns, decreased interest in pleasure in things previously enjoyed, depression or sadness, increased sleep or insomnia, lack of energy, and low self-esteem. We're also going to find difficulty concentrating, unexplained aches and pains, also can be included. Some of the symptoms that I just listed are often thought to be normal aging process. So crying spells, difficulty concentrating, delusions, hallucinations, irritability, demanding behavior, memory problems, confusion, having a slower motor skills, suicidal ideations, or feeling like you're ready to go, or having somebody say, you know, I'm just ready to be done. I'm, you know, I'm okay with this. It's my time. Unexplained aches and pains. So indicators for those depression in older adults are going to be those appetite changes, chronic pain, isolation, medication non-compliance. That is something that goes along with that lack of wanting to do things, or that lack of interest. Having new diagnoses of maybe diabetes or a heart disease, different things of that sort. Sleep patterns, you're going to see different changes in that. It could be that you're sleeping more. It could be that you're sleeping less or not able to fall asleep on time. Or if you do fall asleep okay, you're waking up a couple hours later and you're seeing that you're not able to get all of that sleep that you once were able to. So let's talk a little bit about what we do at Senior Life Solutions and kind of what our program looks like. And so what are the intensive outpatient services? We are family education and family therapy. We have individual therapy, medication monitoring and coordination with a primary care provider. We provide psychosocial assessments, psychiatric evaluation, and transitional care and aftercare planning. So what does that mean? That means that once you're involved with our program, we follow you through the time at our program as you're involved with our group, and then also after that. And so we do provide you with resources after the graduation from the group into the community, whether that be maybe some support groups, some activities that you could have afterwards, maybe you know, individuals may like to go to the library or be involved with men's groups, or maybe the Redhead Ladies, or maybe some individual counseling that you can continue. We also have aftercare meetings and programs. We may do an activity where we invite our patients back for a lunch, or maybe to play bingo, just so that they can get back together with their group, and just for us to check in and see how things are going. What our services look like when you're involved with the group. So we have group therapy, which is our primary treatment. That process is interactive, cognitive, and problem solving. We provide education and training with the medical doctor and the RN. So I am a registered nurse, and I do provide education to the group, sometimes on a weekly, if not monthly basis. For medication, disease prevention, we may talk about different diets, or if our patients have any questions regarding that. Another thing that we talk about is sleep hygiene and health style habits. So what is our criteria for admission to our program? So older adults they need to be given a specific appropriate diagnosis upon assessment to be considered for admission to our program, such as depression or anxiety. One important thing is that the older adult does not need to have that diagnosis when they're referred to us. Our board certified psychiatrist will evaluate them before admission during our assessment process. So as they meet with the nurse and as they meet with the doctor, those diagnoses are able to be given at that time. So psychiatric diagnosis would be that anxiety, depression, dealing with loss, or having memory problems with dementia, which may present as dementia, but because that anxiety and that depression is taking over, it's kind of that false look of what's going on with that patient. Another diagnosis we would look at would be psychosis. As you can see on the screen, there would also need to meet other criteria, such as potential for gain in functional status and potential for success in community reentry as the outcome of our treatment. So the patient is going to need to have the endurance to participate in the program. Functional impairment is probably going to be there in some form. Potential to regain that functional status. So maybe you're noticing that you are not getting up as easily as you once did. You don't want to get out of bed. You're not cleaning the house. You're not keeping up on your physical appearance. So those are some of the things that impairment would be there prior to admission. But that potential for regaining that and having that functional status after our group is something that we're going to look at. And potential for success in the community and re-entering into that process of, getting back to somewhat of that functional status. So maybe prior to going through whatever was occurring that caused this impairment, you're going to be able to re-enter those things, maybe re-entering into your day-to-day functionalities, going back to church, going back to family events, things of that sort. So let's talk a little bit about our results, because we do have really good results. And as you can see, so what are the results of the individualized care? So the education of the patient and family. So we're going to talk about diagnosis, prognosis, community support services. Cost effectiveness, Cigna reviewed of medical care records of 268 intensive outpatient clients versus 517 non-outpatient, non-intensive outpatient control. Psychiatric readmits to the ER and inpatient, and in the intensive outpatient group decreased 53%, while they increased 11 in the controls. So total savings per member was $3,134, and patient satisfaction, there was patient satisfaction and improvement on that as well. So our program results increase education for patients and their families, creating a more sustainable environment for that individual to stay well. Our services are also cost effective for the individual and the community, reducing admissions to the emergency room. As you can see here, 40% of patients decrease their geriatric depression scale at discharge. So this is one thing, a test that we do not only on intake, so that's that initial meeting with the nurse. We see that 40% of that improvement in our patients in this scale. So next we're going to look at that 60% of our patients no longer suffered from depression at discharge, which is huge. So readmission of that depression and being able to return to that normal functionality is a huge success for our program. Next, we're going to talk about another, which are Zong, that measures our anxiety scores, and 76.2% of patients no longer had clinically significant anxiety at discharge. So saying that our goal is to decrease that, but knowing that 76% or more of our patients no longer had that clinically significant anxiety is huge. Lower scores at discharge indicate improvement. A cutoff score is 45, and with scores over 45, suggesting that the presence of a clinically meaningful anxiety. So if you suspect that somebody would benefit from our services, let's talk a little bit about how to refer them to our program. So knowing that we have success in our program, knowing a little bit about our program, that we do offer the group Monday through Friday. So Monday, Wednesday, and Friday typically are our groups. We offer that group from 9 a.m. to 11:45. They are in group, and we have patients that are anywhere from 2 patients to 10 patients. And during that, we have talk therapy with our therapist, Amy, who guides our group to help with those coping skills, talk through different things of what may be going on, and having that support of the group is huge. We also offer the individual therapy sessions with Amy, and that can be anywhere from 1 to 2 times a month to weekly. We also offer family therapy where patients can bring their family members or their loved ones in, and we provide that support not only to the patient, but also for their families, because we know that when we're going through something, our loved ones also are affected by that. And it may be that they need to help have that support as well. So we do offer that. And Dr. Jordania, who is our psychiatrist, she does offer that medication management and that medical support. And you, as a patient, the older adult would receive those services monthly, and if needed, more. Our patients can see our psychiatrist as often as needed. So referring to our program is pretty easy, and it really is as easy as giving us a call. I will provide our phone number and referral information for you at the end of the program. And so giving us a call, no diagnosis is needed. As I said before, our doctor does do that intake, and she will provide the appropriate diagnosis that would be needed to admit into our program. We also provide insurance verification, so that is not something that we want you to worry about. We really just want to reiterate, just give us a call. So when you call us, what does that look like? If you or someone you know needs assistance, all you're going to do is reach out to us, and we're going to ask you some follow-up questions. So tell us why you're referring the older adult, and we can take it from there. What we're going to ask you is we're going to ask you a name, of course, and a phone number. That really, honestly, is all we need. We can take it from there. We will reach out to that person. We will do everything we can to get a hold of them, and all of the other information we can get from the patient, and we really can lead everything going from there. However, we are going to ask some follow-up questions to obtain basic information on that individual. And again, like I said, don't worry if you don't have that information. A name and a number really is all that we need to take those first steps. You can refer people from your church, book clubs, someone from the neighborhood. At least if you give us a call, all you need is the name, the number, and why you're calling. And we're really going to do the rest for you. Again, we do not need a diagnosis for a patient to be referred to the individual. Take care of all of that after that referral is made and prior to admission. We will also verify insurance individually with each person. It is then that the individual's choice so we will verify the information. We will then speak with the patient, let them know what the verification of the insurance was. And at that time, it will be their choice whether or not they decide to join our program or not. We are 100% a voluntary program for our patients. And so everybody that comes to our program wants to be here, which is another reason why we are so successful, because they want that help. They understand that they need that help, and we are able to show them the success that we do have, and they are able to help each other succeed in that group, which is great. So let's talk a little bit about what we do. So we are just a phone call away. As the phrase goes, if you see something, say something. Everybody knows that if we don't know there's a problem, we can't help with the problem. So if you notice somebody in your friend group, your family, a community member that has lost their zest for life, don't wait, don't take the risk. Don't say, well, if it gets to this point, then I'll call, or maybe we'll give it a week and see how they're doing. Make that call. During that week, anything could happen. Um, you know, as that anxiety and depression gets worse with those individuals, that depression, that anxiety could get to the point where that weakness from not sleeping as well as they used to, or not eating as well as they used to, could result in falls, or could result in some type of an injury, or result in maybe them harming themselves or somebody else. So the earlier that you reach out, the better. And really just letting them know that they do have that resource in the community. So we are here to help. I will again put all of our information in the comments, but I will also let you know our number is 515 433-8713. That is our direct number to our program, and we do answer our phone Monday through Friday, and we are here 8 a.m. to 4:30 p.m. There is a confidential voicemail that you are able to leave a message if we are not available, and if there is an emergency, we always recommend that you go to your closest emergency room or you dial 911 so that you can get help immediately. And also, I would like to say, even if an individual is not older, don't hesitate to call us. We do want to help everybody in our community. We want to be that mental health resource for our Boone County and for our hospital, our patients, and be able to provide them information and resources to everybody. You also can fax us information, and our fax number is 515 433 8716. And also you can refer to us on the Boone County Hospital website. There is a referral link that is on there if you look up Senior Life Solutions on the Boone County Hospital website. So whether through our program or another service, our team works to identify and address the mental health needs for those in our community and provide support. So we want to reach out to all members of our community. Mental Health Awareness Month is coming up in May. We're going to have a ton of new and exciting things that we're going to be doing since we are new to our community. We're going to be talking a lot about what to look for, the resources that we have available. And also, we want to break down that stigma of mental health and let you know that it is not the things that we talked about, that difficulty sleeping or the loss of appetite, weakness, those are not normal signs of aging. And that could be a sign that there is something going on. And so reaching out to us and allowing for us to kind of walk through those things with the individuals in our community is so important. And so we are excited to be able to serve Boone County, be a part of the Boone County Hospital, and learn along with our community and just be able to reach out to everybody. We are so grateful to be here, and we look forward to working with everybody. At this time, I will pause and answer any questions that you might have.
Thank you so much, Heidi. If anybody has questions, feel free to put them in the chat. And I wrote down quite a few things, and so many things of what you were saying were just really resonating. And I really appreciate you offering also to be a resource for people to just call, and then you can help connect them with mental health services that aren't necessarily just for seniors. And I've been listening to a lot of podcasts lately, and it seems like there's also this loneliness epidemic that's happening. And you're probably hearing a lot about that too. I think that that's something that has structurally changed within our communities over time, but also then the pandemic really changed that as well. And so having a place where people can come together and, have their voice be heard, feel supported by other people, feel supported by their peers, is just so, so important. So thank you for the work that you are doing. And you actually
Thank
answered
you.
quite a few of my questions in terms of how often people meet. Are you meeting in groups by um, any particular like diagnosis, or is it a conglomeration of people just placed together?
That's actually a really good question. All of our patients meet together. And the reason for that is because even though we have separate diagnoses, um, a lot of the symptoms and a lot of the trials that you have from those different diagnoses are the same. And so, what we have found is that being in that group and providing that talk therapy is going to kind of help everybody. And then, patients that are maybe dealing with the same thing, but maybe dealing with something else, they also can learn from each other. And so, somebody that has a different experience with a different diagnosis may be able to help somebody that is having maybe the same symptom, but they're at a different level. And so we do have everybody together, and we do kind of manage those groups and what we talk about in those groups depending on the individuals that are in the group, but they are all together. And then they work with Amy directly in those one-on-one sessions with their independent diagnosis and what is going on one-on-one with them. So they're able to work with the group and kind of have that support and that fellowship with everybody in the group, but they're also able to work on that one-on-one individual with Amy or with their family as well.
Great, great. Thank you for that. And that also brings me to, I'm curious about the service area. Is it just Boone County, or is it our hospital service area that you're serving?
So we service a 30 to 50-mile radius. Generally, it's a 50-mile radius, and I say 30 to 50 because we do have some programs that are fairly close to us. So we are going to share a little bit of that territory that normally our program would. So we are going to go out Ames, Nevada, Madrid, Huxley, Stanhope, Ogden. As we get a little bit past Ogden and up towards Webster City, there's a program in Webster City, there's a program in Manning, one in Perry. So no matter where you live, no matter how far away you are, giving us a call is always, again, that first step, because if you are a little bit outside of that area or there may be a program that's closer to you, we will be able to get you in touch with the right individuals, whether that's another Senior Life Solutions program or that's somebody else or another program in the community that would be better suited for your needs.
Great. Yeah, it sounds like they're in so many hospitals. Are there, like, and maybe you don't know it off the top of your head, but do you know how many hospitals it's in around the state of Iowa, or anything that you can tell us a little bit more about that?
I don't know exactly how many are in the state of Iowa. I want to say maybe around 10, but we have over 120 throughout the country.
Okay.
And one of the great things is that we do focus on the older population, 65 or older, and we also focus on those rural areas, the places that don't have a lot of those specialties. And a lot of times we do have the smaller hospitals. We're very fortunate in Boone that our hospital has so many great specialty things that we offer here. However, a lot of the small communities don't have a lot of that. And so Senior Life Solutions is one of those programs that really focuses on those rural areas so that we can offer those services to the individuals that may not have had that very often.
Okay, great. Well, thank you. And that answered one of my questions too, was I was curious if it was a nationwide or national program. So,
It
so that
is.
answered that as well. So thank you for that. And let me just check. Oh, one other question regarding how people get here. So if they can't drive or they don't have access to transportation, can we help them with that?
Yes, so we do have some options. If they are local in Boone, we have HERDA that is able to pick them up and bring them to the hospital. We are also utilizing a couple different services for transportation, but that is something that we will help facilitate. We are working with RSVP, who is a local volunteer program that could potentially have some volunteers that would provide some transportation. There are local taxi services and different things like that. So that is something that can be a hurdle, but we have had great success in working through that and allowing for individuals that don't drive to be able to come to us. But one of the great options is, you know, COVID kind of introduced us to a whole ton of new things, some good and some bad. One of the great things that it brought us was telehealth. And we do offer our services via telehealth. And so individuals can participate not only in our groups, but individual sessions and with our doctor right from home. So you don't even have to leave home as long as they have that internet access or access to a cell phone. I will help them get that set up, and generally I do go out to the individual homes and meet with the patients. And if they are somebody that would like to meet via telehealth, I will help them get set up with what they need to do that from home. So whether we can provide that transportation or we are able to meet their needs remotely, we are able to do that.
Great, that's excellent. So I guess I have one more thing and more of a comment than a question. I'm guessing that you're really open to going out and doing more programs out in the communities. So if
Yes.
people are listening to this and they're thinking, oh, my PEO group or my whatever group needs to hear this, more about this program, they can obviously reach out to you through the same phone number you gave and recruit you to come do more speaking engagements.
Yeah, I would love to do that. And it doesn't have to necessarily be for older individuals. I would love to come out and talk to anybody and provide education on mental health, going to the schools, talking to the kids, or church groups, maybe just a group of individuals that get together, whatever the case is. If you are at work and you provide monthly in services, I would love to come out and share the resources and just have spread as much awareness as possible and get that education out there. So I am available to provide that. That is a service that we are excited to do, and one thing that I personally enjoy doing. So yes, reaching out to me. I have provided my email in the comments, and also I did put our group program number as well in the comments.
Okay. Great. Thank you so much, Heidi. I think that covers all of my questions. Was there anything else you thought of that you wanted to add?
No, I am good. I'm so grateful that you had us and we're able to share our program. And again, I just am so grateful to the community for being so welcoming to us. It has been great. We opened on March 20th and it's been such a success, and we're up and running and off to a great start.
That's wonderful. And yeah, as I started to kind of say earlier too, with this loneliness epidemic, and we know that we have a shortage of mental health providers and therapists and all that out there, just to have this service is a big deal and very, very important to everybody, but very fortunate to have it right here in Boone County. So thank you for your work on that, Heidi. Thank you for
Thank you.
your presentation today. Appreciate it.
Thank you so much. Have a great day.
You're welcome. Thanks. You too. Bye.